Coughs and colds are very common. Every year adults get an average of 2 to 4 colds, and 2 to 5 coughs per year. They are infections that are caused by viruses and are rarely serious. Coughs and colds usually get better by themselves. Complications of colds can include chest infections, pneumonia or ear infections, but these are very rare. Coughs are usually harmless, although they can affect your quality of life as they can be irritating and distressing to yourself and others. Symptoms of a cold include cough, sore throat, blocked nose, mild temperature, runny nose, headache, sneezing, aches and pains. Coughs can be dry and tickly and usually felt in the throat. Coughs can be chesty and productive where you produce phlegm. Coughs that last less than 3 weeks are known as acute and generally caused by viruses. The cold virus can be spread by coughing, sneezing or transferred by touch. If you have a cold, you should wash your hands often and carry tissues to prevent spreading your cold. Adults can expect cold symptoms to last about a week. In young children, symptoms can last up to 2 weeks. In the first 2 to 3 days, cold symptoms are worse. After this, they should start to improve. Coughs can last 3 to 4 weeks after your cold has got better. Unfortunately, there is no cure for the common cold. Our bodies naturally fight the infection, and there are medications you can buy over the counter to help relieve your symptoms. Rest. Get plenty of rest until you feel better and are well enough to return to a normal level of activity. Eat healthily and drink plenty. Drink plenty of fluids, preferably water, to prevent dehydration. Eat a healthy diet which includes 5 portions of fruit or vegetables a day. Stop smoking. Smoking is the most common cause of chronic cough. By stopping or cutting down smoking, you can improve your cough and also reduce the risk of heart attack, stroke or lung cancer. Home remedies. Honey and lemon can help to soothe sore throats and ease coughs. Steam inhalation can help blocked noses. Try not to cough. This is not easy, but the desire to cough is sometimes controlled by the brain, so trying not to cough can help you cough less. Antibiotics will not cure coughs and colds, and rather than helping you feel better, they could cause harmful side effects. Over-the-counter medicines can help relieve symptoms. Your local community pharmacist can offer you help and advice. Paracetamol, ibuprofen or aspirin. These can help reduce symptoms such as sore throat, fevers, headaches, aches and pains. The maximum recommended daily dose of paracetamol is 4 grams or 8 tablets in 24 hours for adults. Lower doses are recommended for children. Many cold remedies contain also paracetamol, so check the ingredients carefully. The paracetamol in cold and flu remedies counts towards the maximum daily dose. Buprofen and other non-steroid anti-inflammatory drugs should be used carefully, especially if you have or had a stomach ulcer, asthma, heart, liver or kidney problems, and patients taking certain blood pressure tablets should check with a pharmacist first. Aspirin should not be given to children under 16 as it can cause a very rare illness called Rhys syndrome, which can be fatal. Cough mixtures are available for dry coughs and chesty coughs, however there is little evidence that these work. Many cough, cold and flu remedies contain paracetamol, which count towards the maximum daily dose. Take care not to take too much. Decongestants in nasal sprays and tablets can help clear blocked noses. They should only be used for 3 to 7 days, as longer use can block your nose up again. Vapor rubs and steam inhalation can also help unblock stuffy noses. Some cough and cold remedies can make you feel drowsy. This can be helpful if you are having trouble sleeping, however do not drive if you feel drowsy. Most over-the-counter medications for coughs and colds are not suitable for children under 6 years old. If your child is unwell, your local community pharmacist can offer you help and advice. Most coughs and colds are not serious and get better themselves. However, contact your general practitioner if you experience any of the following: high temperature above 39 degrees Celsius, confusion or disorientation, sharp chest pain or shoulder pain, severe headache, cough up blood in your phlegm, difficulty in breathing, weight loss for no apparent reason, a hoarse voice for longer than 3 weeks or hoarseness that persists after your cough has gone, severe swelling in the neck and or armpits. Symptoms: cough that lasts longer than 3 weeks,